Hi, I'm Michelle Barrett. I am a nurse practitioner with KSB Cardiology. Since February is American Heart Month, I would like to take a few minutes to discuss ways we can try to keep our hearts healthy and avoid heart disease. Heart disease is the leading cause of death in the United States for men and women. Currently, 1 in 4 people will die of heart disease. The term heart disease refers to a variety of heart conditions, but the most common one, and what I will discuss today, is coronary artery disease. Coronary artery disease, which I will also refer to as CAD, is a buildup of plaques made mostly from cholesterol on the walls of the arteries that provide blood flow to the heart muscle. When plaque builds up, it can cause narrowing of the arteries over time and can lead to decreased or blocked blood flow to the heart muscle. The plaque buildup increases our risk of a heart attack, as well as the risk of weakening the heart, leading to heart failure. So, when is a good time to seek medical attention? Of course, most of us know that if we have that sudden squeezing chest pain, we should seek immediate medical attention. But we can also have subtle symptoms that come and go or worsen over time. Common symptoms of coronary artery disease include chest tightness, pressure or burning in the chest, shortness of breath, pain in the arm, neck, or upper back, nausea and sweating, fatigue, indigestion, decreased endurance. Some people, women or diabetic people, will more have that fatigue, indigestion, or decreased endurance. If you're experiencing these types of symptoms, I would encourage you to make an appointment with your healthcare provider for further evaluation, because these can be signs of coronary artery disease. There are certain things that increase our risk of heart disease. Some of them we cannot prevent, such as aging and genetics. Luckily, there are things we can do to reduce our risk of heart disease. Risk factors that we can control include high blood pressure, high cholesterol, blood sugar levels, obesity, poor diet, sedentary lifestyle, smoking, and excessive alcohol consumption. Luckily, we do have the ability to make lifestyle changes to decrease these risks. I'll start with blood pressure. Controlling our blood pressure. The American College of Cardiology recommends blood pressure lower than 130/80. Ideally, keeping blood pressure closer to the 120/70 range is recommended. It is important to periodically monitor your blood pressure and speak with your healthcare provider if it is consistently higher than that 130/80 range. Lowering our LDL, which is the bad cholesterol, think lousy cholesterol, and raising our HDL, which is the good cholesterol, think happy cholesterol. For someone with heart disease, it is best to keep your LDL under 100, and in some circumstances, such as somebody with diabetes, that number is lower at 70. Increasing the HDL to 40 or higher helps combat your bad cholesterol. Keeping our blood sugar controlled. The risk of heart disease is almost twice as high in people with diabetes. Keeping a tight control of your blood sugar levels helps to lower that risk. That brings us to our diet. What we put in our bodies has a huge effect on our overall health. The American Heart Association recommends a balanced diet high in fresh vegetables and fruits, healthy proteins such as fish, seafood, legumes, and poultry. They recommend whole grains and low-fat dairy in moderation. Avoid processed foods, added sugar, and added salt. Having a sedentary lifestyle. Increase your physical activity. The goal is 150 minutes of moderate exercise or 75 minutes of vigorous exercise in a week. Getting a regular, moderate to vigorous exercise can be shown to lower blood pressure, blood sugar, LDL, and increase our HDL. 150 minutes seems like a lot, but it comes out to 30 minutes a day, 5 days out of the week. We probably kill more than 30 minutes every day scrolling on our phones. Making a small change, such as walking for half an hour after work, is one way to start implementing physical exercise. Avoid tobacco and nicotine-containing products. Smoking contributes to inflammation, causes damage to blood vessels. It increases our blood pressure and our heart rate. It lowers that good cholesterol and raises the bad cholesterol. And it makes it harder for our blood to carry oxygen. According to the National Heart, Lung, and Blood Institute, quitting smoking may lower our risk of a heart attack by up to 50%. I acknowledge it's a hard habit to quit, but there are a lot of resources available, including patches, gums, medications, and behavioral therapies, and your primary care provider can help you decide what's the best choice. Try to limit alcohol consumption to less than 2 drinks per day for men and less than 1 drink per day for women. Diet, exercise, avoiding tobacco, and excessive alcohol are hugely beneficial to lowering our risks, but the thought of making a whole bunch of big changes at once can be overwhelming. So instead, start small, make some small goals, and work towards that healthier lifestyle. Sometimes we can make all the appropriate changes and we still need a little help with managing our health. This is where medications can be helpful to keep our heart healthy by lowering blood pressure, heart rate, cholesterol, or blood sugar. If you haven't been keeping track of your blood pressure, your cholesterol, or those other numbers, your blood sugar, Heart Month is a great time to set up an appointment with your primary care provider. Your provider will check your blood pressure in the screening labs. If you have some of those symptoms I talked about earlier, your provider may refer you to cardiology to discuss further testing. If you have any questions about your heart health, you can comment on here or contact your primary provider's office, or you can contact me at KSB Cardiology. Thank you.